Joining us for this fifth and final session of the day so far, policy proposals to tackle the COVID-19 pandemic. I'm sure all the panels that have preceded this one have been deep and meaningful, but I can't help but think that this final panel is really where a lot of the serious talking has got to be done, because so much of this entire global situation rests in the hands of policymakers, and what they're going to do is going to drive the conversation. I'd like to begin talking about these policies by just highlighting for you a report that came out of the UK just a few weeks ago. It came from Britain's Office of Budget Responsibility. And what it said was that the fallout from this COVID-19 event on the UK economy would drive it into the worst recession it has seen in 300 years. Not simply since the Great Depression of the early part of the 20th century that most people are referring back to, 300 years ago, they're saying. And in the face of this particular prospect, one of the more surprising comments that came out came from the former finance minister of the UK, George Osborne. And he came out saying that Britain's policy reaction to this problem must be what he called a period of retrenchment, which came as a surprise to a lot of people. What he wanted was a cut in public spending and activity designed to bring down government debt. And this at a time when obviously a lot of governments are spending a lot of money to try and keep their economies afloat. Now, these comments caused a lot of debate and furore in the UK because George Osborne, this former finance minister, was the architect of the previous financial austerity situation in Britain that caused a lot of hardship, particularly to the poor of the country. And people are wondering whether further belt tightening is really the right policy to attack this COVID-19 situation. Now, I bring that particular situation up specifically because governments across the world, especially here in Asia, are having to face similar questions and similar problems. At a time of unprecedented disruption in their local economic situations, what are the proper policies that should be followed in these countries, given their own particular circumstances, in the short and in the long term? These are some of the questions we'll be addressing today. The decisions don't simply apply to fiscal policy, as George Osborne was talking about. What about policies about healthcare? Should we be revising the entire debate about national level healthcare systems in the light of COVID-19? And what about international trade? Should governments be following the example set recently by Vietnam, which began to put some restrictions on what their exports of some commodities should be in the face of this pandemic? And what of international political relations too? Should governments in Asia leverage the ASEAN community in its existing form to coordinate their future preparedness and contain any potential future pandemics? Or should they follow the example of one particular foreign government and foreign leader in particular and point the finger of blame at other people and other countries for this situation while excusing their own failings? So these are just some of the issues we're going to cover today. And I'd like to introduce to you our distinguished panel who will help us to consider some of these questions. We are joined by Tan Sri Jemilah Mahmood, who's a special advisor to the Prime Minister on Public Health and a member of the Economic Action Council of Malaysia, also the former Under Secretary General at the IFRC. Mr. Santiago Rodriguez Goiecoechea is the Senior Development Advisor at the World Bank. Brigadier General Charito B. Plaza is Director General of the Philippine Economic Zone Authority, and Dr. Dino Patti Djalal, former Deputy Foreign Minister of Indonesia. As you see, we only have three of those distinguished guests with us so far. Hopefully the fourth will join us soon, but we'll kick off anyway. And let me begin, if I could, with Dr. Dino Patti Djalal. I've raised a couple of the issues involved in this. Let me ask you, particularly given your background, about the broader foreign policy perspective on this. Could you just give us a quick thought on what are the international relations implications of what has been going on?
Okay. First, can you hear me? I'm just testing my voice. I assume you can hear me.
I can hear you. I can hear you. Maybe you could turn your volume up just a touch, but otherwise that's fine.
Okay, good. Thank you for inviting me here. I think the biggest question is whether or not countries around the world are able to step up in terms of their international cooperation. And somehow that has been quite slow, partly because a lot of countries are turning inward and asking what can they do to save themselves, right? So the instinct is to turn inward and me first. So that's one. But the second thing, the geopolitical rivalry is still there, particularly between the United States and China. And that has colored the way international cooperation has taken place in the last 2 or 3 months. Tension is still there. Negative rivalries or competition is still there between the United States and China. And countries like Indonesia are really looking to these big powers and saying, hey guys, this is not the time for this. This is time for statesmanship. This is time for leadership. Let's get our act together. I'm seeing some movement in ASEAN. There has been an ASEAN response, although I do think there can be more. At the G20, there has been some response. At the WHO, we still see some stress, and WHO is being crunched in this rivalry between the United States and China, and possibly they can be the scapegoat if things don't go well. And at the UN, there's some good movements, including at the pledging conference. There's been a resolution at the UNGA proposing for international cooperation, but it's still too early to tell whether or not the international cooperation will be at the level that is required for the international community to beat COVID-19.
Well, whether that arises will depend, I suppose, on what you just said about leadership. And I want to come back to you in a moment and talk about where that leadership is going to come from. But let me come to Tan Sri Jemilah Mahmood and talk about specific policies within economies. Let's talk about how one looks at it from an individual nation state level. Now, in Malaysia, we have a situation where the government has been uncertain as to how much to pull back, how much to allow freedom back into the economy, and how much to persuade local states to cooperate with each other in getting the economy started. Just give us a sense of the flavor of debate that you think is going on within the Malaysian government.
Thank you very much. And I think the first thing to say is that, health is always the priority. As Helen Clark says, economies can recover, but dead people can't. So in developing policies for health and economy, we've got to find that balance, and it's always tricky in a situation like COVID. One of the things that is important, of course, is that we have a strong health system. I mean, WHO has laid out 6 criteria before any economy or any lifting of the any movement control. And I think this has been the basis for Malaysia to decide when it eases, the lockdown, so to speak. One of the challenges, of course, is that we are losing 2.4 billion ringgit a day. So there's a lot of pressure on the government as well to ensure that the economy doesn't go into a deep recession. And the most frightening thing is when you have collapse of the banking system. So I think, at all levels, I would say that it's been challenging. In easing the restrictions and restarting the economy, I think one of the things that we must remember is that there's no intention to open completely, but to put in place quite clear standard operating procedures that corporations and businesses need to comply with before they can actually start. And enforcement then becomes very important. Now, Malaysia is in a very unique political situation, as you all know. And I think that, for me, if we are going to move forward, there has to be a real, collaboration between all parties that, with a pandemic at your doorstep, there really shouldn't be political maneuverings, because otherwise we will go into, fits and starts and stops. So I think that what we are learning is that COVID is behaving in a way that, teaches us we have to be humble. Every day we're discovering new things about the virus, the way it's transmitted and so forth. So in moving, our economy, I would say that we have to be cautious. And I think that's, the plan, that your health systems are strong to begin with. And the 6 criteria that WHO has laid out is very, very clear. and that, you know, if there is a need to cope with any rise, you can deal with that, but more importantly, you can also lock it down again. So
I wonder whether, I mean, given what I said at the beginning about
yeah.
the nature of the conversation in the UK, and I'm using the UK as a particularly interesting example of so many of the paradoxes that this COVID has brought up. But one of them is the apparent conflict between health systems and economic priorities. In the UK in particular, the National Health Service for so many decades has been the mainstay of a national health system, and yet the government has been very keen to try and privatize that. And suddenly we're seeing a lot of the questions coming up in this context. I wonder, in Malaysia, do you see a conflict between a health system that is prepared for future pandemics and an economic recovery or economic prosperity in a general sense?
I don't think there's a conflict. I think that the leadership has been very cautious to begin with and instituted a lockdown quite early. But it is also under pressure to restart, not because, because people are actually suffering. People are actually saying that, they can't cope. 60-70% of our economy in Malaysia is driven by small, medium enterprise. And among the small, medium enterprise, a lot of them are actually quite small. And Madam, maybe you can mute your microphone. So I think that it's about also, ensuring people can get on with their lives, because it's easy for you and me, people like you and me, to say we can be in a lockdown for 3 months, but there are people who are actually suffering. So how do we find that balance, right?
Yeah, and I think I want to go a little bit more deeply into that, because where does the spending come from, and how does our health system priorities change in the context of what we've seen? But let's get a couple more opinions in before we open it to a broader conversation. Mr. Santiago Rodriguez Goiecoechea, the World Bank obviously has an official position and a lot of fairly traditional strategies. I wonder if you'd tell us what the World Bank's position is in this context, in this region, and do you think that it's consistent with the other multilateral institutions globally and how they're treating the situation?
Well, thank you very much for the invitation. I would tell you, just by means of a small disclaimer, that I will give you my views, but they may not necessarily represent the official standing of the World Bank as such. But from addressing your question, I think the multilateral institutions like the World Bank and others are very aware of how different the impact of the COVID-19 crisis is going to be in each country. And I think one message that is emerging is the need to protect public health systems. And this is something that has been probably underestimated in the past. But as the crisis moves on, one thing that is clear is that there is a tremendous benefit to having a public good or a public institution, a public system like the National Health Service that will contain the spread of the crisis, not only for health reasons, but also for economic reasons. And that way we can avoid a health crisis becoming an economic crisis, a financial crisis, a compounded crisis that could then have much more damaging effects in the society.
In the comments I made at the beginning about austerity in the UK, what are the fiscal implications of this crisis for governments in Asia? The UK situation is not the same. I mean, the pound sterling as a sovereign currency with its special status gives the UK a degree of latitude that maybe some of the Asian economies don't have in terms of government finances. Do you think the government finance situation around Asia is a particularly troubling one?
Well, I mean, obviously there's always, public finance is also connected to the monetary situation of countries. So there's a link between the fiscal and the monetary that has to be addressed at any point in time by any country. Countries that have managed to build shared systems like the European Union, they have, if you want, an extra leeway or an extra capacity to respond, because they can mutualize debt like the coronavirus bond, or they can coordinate responses. So this is an opportunity for Asian countries to further integrate as well. Obviously, there is a need to have a fiscal response. There's no doubt about that. But there is a limit to how much fiscal response Asian countries can actually put into the table. and the limit has to be sort of complemented by efforts from the central bank as a lender of last resort. And in doing that, the more you coordinate, the more you integrate with other countries in the region, the stronger a response you are able to provide.
Let us welcome to the conversation Brigadier General Charito B. Plaza. Thank you for being able to make it, albeit a little late. We appreciate having you along. We've been talking in general terms about the situation in which we find ourselves. Give us your perspective from the Philippines situation, if you would.
Yes, greetings to all. Assalamualaikum and Ramadan Mubarak to all our friends in the Gulf countries, Asia, and all the participants across the globe at the World Islamic Trade Forum. And allow me to congratulate the International Strategy Institute and the patrons for this WITF, Mr. Santiago, Salahodin, Uno, the former Deputy Governor of Jakarta, Indonesia. In the Philippines, post-COVID-19 business continuity and recovery strategy, we have stressed the three important policy recommendations for which we had adopted at the Philippine Economic Zone Authority, which is the biggest economic zone authority of the country and the biggest contributor to export income of the government. So the first strategy is we are very successful in doing a balancing act and parallel strategy. Balancing act because of the 405 economic zones under the Plaza, and we have 4,506 companies registered in our economic zones, and we have 1.6 million directly provided with jobs. We are proud to say that we maintained a COVID-free economic zones. Of the 1.6 million workers, for example, we only had 5 who were found PUIs or PUMs, and only 1 death, thank God, from the 1.6 million. So because we were very efficient in doing the balancing act of protecting the health of our workers, we are very strict in enforcing the disinfection of our economic zones premises, and every company likewise do their regular disinfection.
Those are remarkable numbers. Sorry to interrupt, but those are remarkable numbers, particularly where I sit in Singapore, where we've seen this really amazing explosion within the community of foreign workers. Was the Philippines experience a result of some policy position, or was it luck, or just the organization of how the foreign workers are in the Philippines? How did you manage that?
Yes, as I mentioned, we are doing a balancing act of really requiring the companies, the 405 economic zones and the 4,500 companies inside our zones to really observe disinfection, the strict use of PPEs, and then we are requiring our companies, for example, to apply the work from home mode, and only a skeletal workforce are allowed to report in our economic zones, observing social distancing. So there is a big chance for COVID not to spread. So we are also emphasizing now on the requirement for a COVID test, a massive COVID test facility that we put up in our economic zones that will concentrate on providing a COVID test for the workers before we allow our companies to do full operations. So with that, we are now almost 2 months since the Philippines had a lockdown. So thanks to God, again, we were able to protect the health of our workers.
Yes, that's a fantastic achievement so far. Everyone talks about a second wave. Let's hope that the Philippines manages to avoid that. Can I move the conversation on a little bit and come back to you, Dr. Dino, about leadership? Now, all of you to a certain extent have talked about individual situations within their individual nations and individual circumstances, and also noted how the experiences have been so different and how the virus itself has been so puzzling in so many of its aspects. Dr. Dino, there was an article in the New York Times not so long ago talking about leadership in the age of COVID. And the interesting thing about it was that it kept praising Western leaders. It talked in glowing terms about how Germany had managed the situation. It talked even about, gave some praise to Italy, of all places, about its leadership. There was only one line, one paragraph in the whole piece that talked about Asian leadership, and that was a nod towards Tsai Ing-wen in Taiwan and the situation there, which I found was somewhat puzzling, given the fact that Vietnam has done a sterling job, Singapore has not done a bad job, Malaysia, I mean, none of the Asian countries have actually been quite as bad as the European countries, and yet the New York Times is praising Western leadership in this. Tell me what your thoughts are on leadership in this global context, and should the West be listening a bit more to what the Asians have done?
Well, I do expect Western nations to show some humility on this. I think across Asia, you see many nations, many leaders exercising crisis leadership. In the Philippines and Malaysia, in my country also, in China also, leaders are doing things that they normally don't do, right? And even in Saudi Arabia, you see what they did to close the Mecca, the Kaaba, which is the holiest place in the world for Muslims. That took a lot of guts. And to be honest, that helped us a lot as well, because through the closing of Kaaba, which was a bold decision, we were able to tell our Muslim population to look at this from a very serious viewpoint, that COVID-19 is not something to be taken lightly. But I think Asians, the Asian leaders deserve some kudos in terms of their handling. I mean, just look at Indonesia. United States went from 2 or 15 to how many hundreds of thousands by today in just a matter of 2 months. Indonesia went from 2 and now still at about 15,000 in the same 2 months, right? So right. we doing quite. I think we're doing quite well. But one important point is that I think what we need to see is U.S. leadership, yeah, because U.S. has the resources, the largest economy, enormous scientific community, and so on. But unfortunately, I think President Donald Trump is more interested in the domestic politics of this rather than taking the lead globally, right? And this is seen in the backing out of the resolution at the UN Security Council on COVID-19. They keep attacking WHO, threatening to withdraw funds and so on. I mean, you know, I used to be ambassador to the United States. That's really not something that I'm used to in terms of U.S. leadership on a global stage, and that is very much a pity.
And in the absence of that leadership, obviously, the big question that everyone is talking about is China going to be the designated leader in all of this? But I don't want to get into a US versus China debate. This has become too much of a political hot potato. What I would like to know, Tan Sri Jemilah, if you would address this, is, you know, what can ASEAN leaders do in this circle to begin to coordinate their own responses and show leadership within this community of people? And maybe, are there steps being now considered for the next pandemic? Because the SARS thing, to a certain extent, managed to unite the responses in this part of the world reasonably well in relative terms. Do you think that this one will also help to gel and coordinate the nations towards making sure that the next one is even better handled?
Yeah, I think that, first of all, I want to echo what was said by Ambassador Dino, and that is humility is very much needed in managing this pandemic, and leaders need to be more humble. One of the things we recognize is that because of the changing nature and the volatility of what's happening with the coronavirus, adaptive leadership is required. It means using evidence, using data, and engaging with people, because pandemics cannot be managed unless communities and individuals are engaged. Now, ASEAN has a very unique and a very strong ability to convene. And I think that's really a very powerful regional grouping. I know that in the early days, the ASEAN leaders met on a video conference and reaffirmed the need to collaborate, because you know, if you cannot be safe until your neighbors are safe, you cannot be safe until everyone is safe. This is the nature of pandemic management. So I think that one of the things I will say is that ASEAN has been very much more able to deal with natural hazards and disasters, but I don't think it's really done as much on pandemic and health security. So this is a real opportunity for ASEAN, and certainly, you know, this COVID is going to stay for a while. So it will be very important for ASEAN leadership now to really come together to look at, you know, not just policy at national level, but the regional policies that need to be developed. We know, for example, in Malaysia that, you know, our borders have to be very tightly watched, because one of the high-risk groups we're seeing is actually people coming home or coming back through our borders. So unless there's a clear collaboration and a framework and, you know, agreement that we will protect each other's borders, I think then, you know, it will be very difficult for us to see, you know, COVID die down.
Brigadier General, let me ask you about the borders situation. I mean, the Philippines obviously relying an awful lot on the movement of people and its citizens working overseas. Tell me how you see this situation, particularly with regards to that travel element.
Well, since we had proclaimed a lockdown, especially in Luzon and in Metro Manila, starting March 15, so immediately we put to hold or stop the travel. So public transportation, flights were all canceled. Up to now, we have stranded passengers, for example, here in Metro Manila. So we are very strict in enforcing the travel ban. And once we have tourists or expats coming from different countries abroad, immediately they are subjected to quarantine requirements, and they have to be in the quarantine areas for 14 days. And
to what extent do you think those policies should now be discussed in regional fora with other leaders around the other governments? Or do you think these are individual nation states decisions that are taken in their own context only?
I think it will be the individual nations' experience, sharing of their experiences, how we were able to prevent the escalation of more COVID victims. Like as of today, we have 11,000 COVID victims, but we have minor deaths, like 200 plus died, and we have a big recovery of those COVID victims. So we are proud to say that, again, because of the humility and the decisiveness of our president, that is one factor. And Filipinos are really very obedient, cooperating with the requirements of the government, like the staying in their homes. We're so very strict with that. And we require our industries, small and medium enterprises, the large industries, to consider work from home. So we have more work from home mode and very few skeletal workforce in our industries. So with that, we were able to maintain a COVID-free industries, companies, and ecozones.
Mr. Santiago, I don't want to ask you to comment on Asian leadership issues and particular circumstances in this part of the world, but I would ask you to comment in general about coordination and global interaction, because you know, so much of this situation has not only exposed how internationalization and how global trade has sort of exposed us to greater threat, but it's also exposed the challenges that come up when we have differing experiences and different cultural and political imperatives in these countries. Is it too early to start beginning to try and draw some lessons on what the future of global trade is going to look like and what the future of global coordination and governance should look like?
Well, I don't think it's too early. I think, I think one has to take the opportunity to draw the lessons and improve the response. I think the new reality that is emerging is a reality where the collective has greater value. The state has probably a lot of important things to do in terms of public health, social policy, and so on. But it also needs to coordinate with other states. And if it does that, then the recovery will be much quicker. I mean, if you think about the reality of many countries, you have hotspots of contamination or contagion around the capital cities, but then you have provinces that are adjacent to other provinces in other countries that are fairly free of the virus. So are you going to live in a situation where you don't allow those two provinces to trade, to interact, to develop their economic relations? Even though that's an opportunity, it's an untapped opportunity to strengthen the cross-country economic relations, especially because in some of the areas in your country, you are still constrained, you still have to do confinement measures and so on. So, I mean, this is just an example of how the new reality is actually telling us that we have to think beyond the borders of the state. Yes, the government has a very important role to play, but we have to think about structures, multilateral agencies, global agencies, and coordination mechanisms that go beyond the traditional state mechanism, that we allow societies to recover faster.
But is that kind of coordination, is that kind of development and evolution possible in a circumstance which, as Dr. Dino has highlighted, in a circumstance where we are lacking a global leader in this conversation? Is it possible for this to be a decentralized coordination effort, or do we need some single party to step up and assume the mantle of primus inter pares, if you like?
Well, I think we shouldn't wait for a primus inter pares. We shouldn't wait for a global leader. I think each region is a leader within the region. You have the regional entities, ASEAN and others, and then you have the states, and they don't need to wait for a global leader to act, whether it's any particular superpower. The lives of the people in each country are in the hands of those people. They don't have to wait for anybody else. Obviously, there is big questions now about the effectiveness of the multilateral institutions. Some people question the response from WHO, whether it was too late. Others question, whether the EU, for example, is being agile enough to respond, and so on. But I think those questions will be always there in a latent way. But the real question is, what can you do with the things that you can control? And what can you do for your own people and your own country?
I want to get back to the issue of health for a moment, if I could. Tan Sri Jemilah, you mentioned the health situation as being the key consideration in all of this. And I would like to ask each of you just very briefly, if you could just tell me what you see as the future of health thinking. And I don't mean in terms of, okay, do we spend more money on this or less money on this? I wonder whether we should be thinking entirely in terms of a reimagining of our approach to health. The thing that COVID has made very clear is that so much of each individual nation's health policy is based upon treatment of circumstances. Should we be thinking more in terms of prevention rather than cure now? Should we be thinking in terms of a much more globalized and much more holistic approach to our health policies? Tan Sri Jemilah, to you first.
I love the question. I think the first thing we have to say is we have to also look at it from a foresight perspective. What is coming? We can't be reactive all the time. This pandemic, we knew it was a matter of when, not if. And yet, everyone is caught unprepared. So I think a real investment in looking at futures and foresight, really understanding what's going to happen out there. The second thing is I completely agree with you that the investment in preparedness is going to be critical. And investment in preparedness is something that many governments or even globally we see very little investment in. So one of the things I've discovered just watching COVID is that we have a fundamental problem in that we have a lot of people who still don't have access to water or sanitation. And here we are telling everyone to wash their hands with soap and water, as though everyone has a tap that they can turn on. So unless we get our fundamentals right, the Sustainable Development Goals gives us a framework from which we can work towards in 2030. The other thing, of course, is that we see a lot more of automation, the use of, when you can't touch someone, what do you do now? We've got to think ahead. What's the use of robotics? Where does technology come in? How do we collaborate? And this is what's happening now with WHO in order to develop a vaccine or to do research. And that is not just about one company or one country doing that, but collaboratively, right. Yeah.
And you're describing, I guess, what is the ideal situation, though. But Dr. Dino, are we in a position to implement such wholesale changes in how we approach these things?
I think so. I think everybody is looking at everything differently now. They're looking at self, at family, at work, at country, at the international order. A lot different now. I think there's a lot more appreciation for these things. And I think also, to connect this to the longer term, it's important for us not just to recover, but it's important for us to just rebound in a better world. There's a $10 trillion stimulus globally that is going to be spent on world economies. I think the question for us is not just how these $10 trillion of stimulus can just make everybody recover, but how also to that $10 trillion will recreate a new world order, which is free from COVID, but also resilient, carbon-free, more inclusive, and so on. I think that is the biggest intellectual, policy, and historical challenge for us all.
I'll put the same question to you, Brigadier General. I mean, it's an intellectual challenge. It's an intellectual necessity to a large extent, but is it a practical reality?
Well, the biggest lesson that we have experienced out of this COVID crisis is the importance of making the nation self-reliant, self-sustaining, because many nations like the Philippines, we are considered as an import-dependent country. So from food to medicines, almost everything is imported. So with this COVID experience, we are now awakened to really make the basic or the essential needs of the Filipino people must be addressed. So that is the economic path now that we are taking. We will situate that we have to make the country stable, self-reliant, self-sustaining, so that we can minimize importation. And if we will succeed in minimizing importation, we make our lands productive, there will be no more idle land, everything is planted, everything is locally made, so that will attract more exporters to invest in the country as well. All because the supply chain is complete. We can provide all the basic and the essential needs of the Filipino people.
We've only got a couple of minutes left, folks, but let me end by asking each of you just to make a quick comment on what you think going forward in the very short term are going to be the most immediate impacts and the most immediate policy changes, if you like, or at least policy proposals that we're going to see as a direct consequence of what's happening. Mr. Santiago, let me begin with you. Just on a global level, what do you see as being the most immediate response that we're going to see at a policy level?
At the global level, I think the global capacity for surveillance, health risks, food safety, and so on, has to be really increased tremendously. That is not achieved by cutting funding to global institutions. That probably requires increasing the funding to global institutions, as well as reforming some of those global institutions that have a mandate for public health, food safety, livelihoods in general.
Okay, Dr. Dino, to you.
For me, very simple. I think the thing we worry most about is the rise of the new poor. In Indonesia, 4 million people have become unemployed in just 2 months, and they're all minimum wage workers. And that means social protection will have to be at the center of government economic agenda. So those two things, the rise of the new poor and social protection for them, which are innovative.
Those are the challenges. I just wonder, what do you think will be the most immediate policy result of those challenges?
Well, I think making sure that the stimulus that the government employs, including ensuring financial stability, will hit the mark. And don't, yeah.
Okay, Tan Sri Jemilah Mahmood.
I think that we need to have a relook at our health security policies, whether at global level, regional or national level, and how do we take global, policies and ensure that they are adaptable to local systems. I think that will be very important.
And finally to you, Brigadier General.
Yes, I look at the COVID experience as a challenge in creating a new approach or a new strategy in achieving peace, understanding, harmony, and cooperation among countries. Like we all suffered from this invisible foe. So we should shift the military wars, the trade wars to a more peaceful approach, like extending our help, our inventions to all the other countries. What we have in each country, we share it with the other countries to create peace. So let's forget about manufacturing weapons of mass destruction, because the pandemic itself that hits the entire world is enough to make us realize how important it is to unite, to cooperate, to share among countries. It should be the kind of a peace approach that we should adopt globally.
And there, folks, we will leave it. We haven't sort of come up with specific policy proposals in the age of post-COVID, obviously. It's still very early days, but certainly plenty of visions, certainly plenty of priorities, and plenty of thoughts as to what should be at the top of the agenda, if not necessarily finely tuned enough to solve the problems. I'd like to thank all my panelists today for joining us. Tan Sri Jemilah Mahmood, Special Advisor to the Prime Minister on Public Health in Malaysia. Mr. Santiago Rodriguez Goiecoechea is the Senior Development Advisor at the World Bank. Brigadier General Charito B. Plaza is Director General of the Philippines Economic Zone Authority, and Dr. Dino Patti Djalal, former Deputy Foreign Minister of Indonesia. Thank you all very much indeed for sharing your thoughts and your insights into this situation. And thank you very much to everyone watching. Appreciate your attendance.
Thank you.
Bye.
Bye-bye.
Thank you. Okay,
Bye-bye.
Thank you once again to all our speakers and moderator for a very interesting session. Ladies and gentlemen, that brings us to the end of this special web conference on our future in COVID-19 world. A dialogue brought to you by the World Islamic Trade Forum. On behalf of the organizer, I'd like to thank all our speakers again and all the participants for being with us. Have a good day. Selamat berbuka puasa to all our Muslim participants, and we hope to see you all again. Thank you so much.